All right. About how do you tell if you are what they call toxic or if you need to detoxify? Okay, well, there's what I want. This is one test that we can all do at home. Let's just do this right now. So what I want you to do is everybody take your right hand, raise it, and let's just do like the Boy Scout honor, two fingers right there. Okay, two fingers. That's not the Boy Scout honor. I'm not sure what to do when you do the pledge. We're gonna take those two fingers. I want you to lay this on your neck right here like this. All right. So it's sort of right in that depression there in front of those muscles on your neck, right there, like that. Can you see where it is on my neck? Do you feel a beating? Do you feel your pulse? Oh, there you go. It's a positive test. You probably need to detoxify. Okay. But I joke, but I don't really joke. Now we understand that even children, right at birth, have foreign chemicals in their body that mom has detoxed into them. Right. So the placenta, we used to think it kept babies safe, but now we understand it's kind of like a detox organ for the mom. So if you're thinking about getting pregnant, definitely want to before you get pregnant detox if possible. Okay. So how do you tell if this is you? If you really need to go a little bit more deeper than just avoidance? Everybody should be trying to like think a little bit more carefully about the products they're using, like we talked about in the last video. Maybe using some green cleaning products or those even safer DIY products. Make sure you've got a air filter, water filter. But what about those of you who are like, I just don't know if this is me? So let's talk about when we clean and detoxify. How do you find out if you are one of the people that needs to have this happen in your life? The first thing that I'm going to say is there are tests that you can take that will show you levels of like heavy metals, right? You can check the blood levels of heavy metals. You can check urine levels of, both breakdown products of toxins and toxins themselves. And the big problem when you get one of those panel tests, I think that they're best used to show a person that, yeah, this is a thing, and you really do have a lot of this stuff in your body, and you need to pay attention to it, right? The question of is how much does it guide care? Well, if you have heavy metals, it does guide care because you might be doing something different. But if you have a bunch of, things, and most of the urine toxin panels actually are looking at stuff in the air and the water and food. And so, how do we detox air, water, and food? We wash our vegetables, eat organic, don't eat processed foods. Okay, so you're gonna eat clean. We want to filter our air and filter our water. And that just kind of goes for everybody. However, there are some of you who have more toxicity and you don't even know it. And this is this is what happens when a doctor gets sick and starts to dive deep into like, why the heck don't I feel good? And that's what I found. Had an issue with toxicity. And I'd never heard of toxicity. In fact, I had laughed at that term. I definitely had like, well, never wanted to be disrespectful, but I did not understand detoxification. And I just was I brushed it aside, right? Until I got toxic myself. So I did some tests to tell, yeah, this was definitely a thing, help me understand. But is that absolutely necessary for you to start to use clean products, filter your air, water, eat cleaner? No, because these things build up over time in your body and they will affect you. Now, how do you tell if you're somebody who has more of an issue that needs more intense treatment? Well, I'm going to go through. You can get those blood work or urine testing. I don't generally recommend the provoked urine testing, although I know a lot of natural and holistic doctors too do. I think it can be actually, when you provoke urinary testing, you force stuff through the kidneys and you could hurt the kidneys. The other thing is, I've heard one of my esteemed colleagues, Dr. Lynn Patrick, talk about how that really doesn't reflect whole body burden. It really reflects what's coming, just what's in the kidneys. I don't do provoked urine testing But we can use other ways to tell if you're having problem with toxicities. One is by questionnaires. And one of the first questionnaires that I took and that I used as I was starting to understand toxicity was the question of symptoms that go along with someone who's gotten sick from mold. Okay. And to give it the idea, oh gosh, you can't even see that, can you? So that's too small for my eyes. Okay. And so this is would be a CIRS, CIRS questionnaire. And you can look that up online. But basically, CIRS questionnaire goes through multiple body systems because if you're toxic from a mold source, you can have everything from memory impairment, attention problems, cognitive problems, headaches, sinus problems, lung problems, breathing difficulty, pains all over, joint problems, muscle problems, gut troubles, diarrhea, constipation, abdominal pain, heavy periods, shock sensation when you touch stuff. So there's a questionnaire out there. All right, and I'll connect it below after I'm done with the video. But so could mold or mycotoxins be an issue? And many of you probably know this is that these guys can be hiding in a wall. You know, it's like it's the classic of the person who cannot sleep because they have headaches and leg cramps, but the house is beautiful, right? And they're like, "There's no mold here," but then you tap into a wall or look under the mattress, and you're like, "Oh my gosh, yeah, I realize that, yeah, I spilled water. Water was on the mattress last year, and now there's all this mold growing on the mattress." So this person's basically sleeping and steeped in mycotoxins. Okay, so that'll make you sick. Um, Other questionnaires that can be helpful, and this one I think you're going to be able to see a little bit better. This is a toxic exposure questionnaire. All right, so it actually goes through where are the sources that you might be exposed to things. And I wish that I could zoom in on this, but I'm going to attach this to the bottom here, and it gives you an idea of the places that you can pick up toxins without even knowing it. So you guys want to go through, and if you're finding yes, 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 I'm answering a bunch of these potential exposures, you might be more likely to be having a problem with toxicities. Now, let's say you answer all those yes, but you feel fine, then that means you don't need to dive deeper and like do something like taking binders or doing chelation therapy if these are yes but you feel fine. However, on the other hand, what if you have some potential exposures and you feel like hell, right? Especially if you've been to your doctor and they say, "I've checked the labs and you look good, eat well and exercise." Well, if that's going on and like, you know, your doctor says you're fine, you feel bad, you know something is happening, that it makes it more likely to be something hidden like toxicity. And so the MSQ, I'm also going to attach this. If you score yourself on these, like it's your head, it's your eyes, ears, if you score really high on a lot of these, like you know you have a score in the upper hundreds, then that tells you that, and you don't have a clear reason for it, then we're thinking toxicity. Okay, I think of, you know, multi-system, multi-symptom issues, and then what you can do is, of course, you're going to do the things we've talked about. Filter your air, filter your water. On an earlier video, I showed you the Corsi Rosenthal box. If you can't afford a fancy air filter, well then you make a cube and you can look at it online. I'll put the link to that again in this. The Corsi Rosenthal box is a DIY air filter, especially when the fires come, you guys, right? So when the fires come, you just put a box fan on top of like a cube of house filters, and that really does a pretty good job of filtering air in a place. So you want to filter your air, water, and then eat clean. And then if you are still having issues with toxicity, Dr. Joe Pizzorno wrote a great book, like how to use food as a way to detoxify. What is it? It's on my bookshelf. I can't see it. I can't remember the name of it. It's Dr. Joe Pizzorno. It's a wonderful detoxification program that you can use to help pull toxins out using food. Because you guys, guess what? The cruciferous vegetables. This is why I tell you, you're not eating enough vegetables. I promise you're not eating enough vegetables. So we all need to eat more vegetables, right? And so the cruciferous vegetables, onions, and things like broccoli and dark green leafies, those are really good for helping your body detoxify. Sometimes we have to take it deeper. We need to use binders, things like chlorella and charcoal, especially if you have lots of symptoms. And the other thing I'll mention is that sometimes multiple symptoms can mean that there is a hiding infection, an infection that's creating its own little toxins that's causing you to be sick. And that would be the other thing we think about when somebody has lots of symptoms, but no signs of a specific conventional illness. That's when the natural holistic doctor goes, huh, what's underneath there? What do we need to reverse? What kind of root cause we're going to manage? But for those of you in my program, what your homework is to take this MSQ and take this toxic exposure questionnaire, and then also tick off all the positives on the SIRS questionnaire if you're in the program, so that we can look at these together and determine whether or not we want to add other things, other treatments to your plan. Finally, I'll say that it's worth looking into whether metals are an issue for yourself. So those panels your doctor can order, lead, arsenic, mercury, cadmium. These have a deep effect on your health, and you need to know if this is an issue. If you got metal fillings in your mouth, mm, if everybody just could gradually have those out, because I see people with memory problems as they get older, and if they have a lot of metal in their mouth, you got to go, huh, is mercury part of the challenge there? And it's difficult to accurately assess mercury load in the body. So just look at it in your mouth. If you have a lot of mercury, you want to slowly take it out and make sure that you do a detox around that removal. And I'm also going to attach my Institute for Functional Medicine amalgam detox protocol if you're going to have amalgams removed. All right, you guys, thanks for listening. I hope that you have an awesome day, awesome, clean day, wonderful day, and that it's free, it's toxin free. And I will see you on